HIV soars after a deadly war in Ethiopia's Tigray region, by Fred Harter, Associated Press, March 26, 2025. Ethiopia's Tigray region was once considered a model in the country's fight against HIV. The woman survived 2 brutal attacks in the dying days of the war in Ethiopia's Tigray region. First, she said, she was dragged to a military encampment and gang raped by Eritrean soldiers who held dozens of other women. 2 days later, she was raped again by a group of militiamen, broke her collarbone and her wrist. They also infected her with HIV. More than 2 years later, she can sometimes buy antiretroviral drugs by selling part of the wheat she gets as a displaced person, but it's not enough. But my disease is getting worse and worse, the woman told the Associated Press at a clinic in Shire, a town in northwestern Tigray. The AP typically does not identify people who are victims of sexual abuse. Tigray was once considered a model in the fight against HIV. Years of awareness-raising efforts had brought the region's HIV prevalence rate to 1.4%, one of the lowest in Ethiopia. Then, in 2020, war began between Ethiopia's government, backed by neighboring Eritrea, and Tigray fighters. Sexual violence was widespread in the 2-year conflict, which also had mass killings, hunger, and disease. As many as 10% of women and girls aged between 15 and 49 in the region of 6 million people were subject to sexual abuse, mostly rape and gang rape, according to a study published by BMJ Global Health in 2023. At the same time, Tigray's health system was systematically looted and destroyed, leaving only 17% of health centers functional, according to another study in the same journal. As a result, 90% of sexual violence survivors did not get timely medical support. The woman told the AP she did not get medication for nearly 8 months. The window for receiving prophylaxis to prevent HIV is 72 hours. Today, the HIV prevalence rate in Tigray is 3%, more than double the pre-war average, according to local health authorities and the United Nations. The rate among the region's roughly 1 million displaced people is 5.5%. Among sexual violence survivors, it is 8.6%. It was a horrific conflict, said Emmanuel Haile, the head of Tigray's health bureau. War was everywhere. Crops failed, rape was widespread, hospitals were vandalized, drugs were interrupted. The complete breakdown of Tigray's health services also meant existing HIV patients did not receive antiretrovirals during the war, increasing their risk of transmitting the virus through pregnancy or unprotected sex, Emmanuel said. Condoms were available during the war, which saw Tigray cut off from the rest of Ethiopia. Today, some destitute, displaced people engage in sex work to survive, another factor that health workers believe is contributing to the spike in HIV cases. The Trump administration's decision to kill 83% of U.S. Agency for International Development programs globally is worsening the situation. Ethiopia has already laid off 5,000 health workers who were hired with U.S. funds to combat HIV. Meanwhile, charities helping HIV patients receive treatment have received stop work orders. They include the Organization for Social Services, Health and Development, a national agency whose Tigray branch was testing people for HIV and giving HIV patients food and financial support. Since the end of the war, things were slowly improving, said Yirga Gebrexiaber, OSSHD's manager in Tigray. Now so many services have stopped again. Like the rest of Ethiopia, Tigray is also grappling with sharp rises in other infectious diseases because of the effects of conflict, climate change, and funding cuts. Additionally, malaria cases have soared from 900,000 in 2019 to over 10 million last year. The war interrupted efforts to distribute nets and spray high-risk areas with insecticides to prevent the mosquito-borne disease. Measles rose from 1,941 cases in 2021 to 28,129 in 2024. Cholera and tuberculosis are also making comebacks. say Tigray is particularly ill-equipped to deal with these outbreaks. It has few ambulances after most of its emergency vehicles were destroyed in the war. Some doctors have not been paid for 17 months, and its biggest health facility, Harter Referral Hospital, only has 50% of the drugs it needs. These outbreaks are extremely damaging, said Emmanuel with the Regional Health Bureau. We have a lot to rebuild, and outbreaks take up whatever meager resources we have. Meanwhile, millions in Tigray still rely on humanitarian aid, and 18% of children are malnourished, leaving them vulnerable to diseases. We are attempting to rebuild, but still in a state of crisis, said Abraha Gebrexiaber, the clinical director of Harter Referral Hospital. Abraha's institution is grappling with severe budget cuts and debts that mean it cannot afford basic drugs or items like tubes and syringes. The hospital requires patients to pay for services that were previously free. Crucially, the war also destroyed Tigray's system of community-based health insurance, a low-cost program that underpinned the region's health system. Restarting this scheme is the Health Bureau's top priority, Emmanuel said, but Tigray's political leaders have become locked in a power struggle that escalated this month when a faction took over several government offices. That threatens to deter donors who have memories of the recent war.
HIV ተሸከምት ልባሉ ሰባትስ ሓዊና ልውሉ ደረጃ ልወጽሕሉ እዩ ነይሩት ነበረ ሁነታት ኣብ ሰዓት እዚ ግን ምስትል ነበረ ናይ ኩናት ኮንዲሽን ብዙሓት ደቂ ኣንስትዮ ብጾታዊ ዓመጽ ተጠቃዕቲ ኮይነን ንብዙሕ ሕማማት ተቃሊዐን እየን ብፍላይ HIV ኤድስ ማለት እዩ
Quite a substantial number of the health facilities in Tigray were damaged. According to the study we did together with World Health Organization and the Ministry of Health, it's called HIRAMS, Health Resource and Services Availability Monitoring System. 86% were partially damaged, 3% were completely damaged. And if we look at the medical equipment, 72% of the health facilities had partial damage or looting of their medical equipment, and 27% of them had complete damage.
Evelina, I know it's graphic, but describe to us what is happening to women and girls in the Tigray region of Ethiopia.
Sure. Of course, recent months have seen a lot of evidence coming from the region, shedding light on the dire situation of Tigrayans in Ethiopia. And of course, we've seen evidence of mass killings. We've seen evidence of torture, abductions, and many other atrocities. But of course, this evidence was followed also by evidence of the use of rape and sexual violence against Tigrayan women. And at the end of January 2021, we've seen evidence from the UN Special Representative on sexual violence in the conflict, Pramila Patten, reporting on the serious allegations of sexual violence in Tigray, including a high number of alleged rapes in the capital of Mekelle. But subsequently, of course, the more and more evidence emerged. And of course, this brings us to this new report produced by Amnesty International and published only a few days ago that adds to the evidence. It concludes that sexual violence in the context of the conflict has been accompanied by a shocking level of brutality, including beatings, death threats, and ethnic slurs. And it is often accompanied by threats and by additional acts of physical and psychological torture. And as one of the Tigrayan women who testified reported, they raped me one after the other. I don't know if they realized I was pregnant. I don't know if they realized I was a person. Some of the abused women and girls were held in sexual slavery for several weeks. And as Amnesty International concludes, the patterns of sexual violence emerging from survivors indicate that the violations have been a part of a strategy to terrorize, degrade, and humiliate both the victims and the ethnic group. And of course, we already mention that of course there are so many perpetrators involved in the atrocities, and it's very important to emphasize that Amnesty International classified the atrocities as crimes against humanity or war crimes, but we cannot forget that these atrocities can also amount to genocide. There could be genocidal methods to bring about the destruction of the community. So this is yet another element that needs to be.
Absolutely, and forgive me for jumping in, but you did mention this issue of genocide and ethnic cleansing to a certain degree, I believe. So I just want to quote something that the Prime Minister of Ethiopia has mentioned, which is referencing the Tigray people as a cancer and wanting them wiped out. So, as succinctly as you possibly can.
Latest barrage came in an Amharic tweet this week. He characterizes the Tigrayans as weeds. We will work to remove the weed, but while removing the weed, we will try our best not to damage the wheat. Many observers have characterized his comment as dehumanizing. In the same statement, he also called the Tigrayans a cancer and a devil. His opponents accuse Ahmed of committing genocide.
የሰሜን ዕዝ ጥቃት በሚመለከት ምንም አይነሱ ሰሜን ዕዝ ባልተጠቀም ተዋረደ። ሴቶች እኮ አሁን በወንድ የተደፈሩት የእኛ ወታደሮች ግን በሳንጃ ተደፍረዋል።
For those of you who can't speak Amharic, he basically said, while their women might have been raped, our soldiers were stabbed with daggers. Now, in my opinion, this is one of the most disgusting things I've seen a head of state say in my lifetime. I may only be in my early 20s, but Jesus Christ, he basically just equated the mass rape of thousands of women who have nothing to do with the warring parties involved who are actually, fighting this conflict. He compared their rape to the killing of soldiers who sign up to die. Like, I'm sorry, I have respect for all those who decide to go into military service. But as a soldier, you are accepting the real possibility that you will be killed in combat. So to compare this rampant sexual violence against the Tigrayan women, to compare that to killing soldiers who sign up to die in combat is just mind-blowing.
Seeing those atrocities happening and hearing yet another call to towards violence, called to destroy the communities, the Tigrayans in Ethiopia.
You've mentioned the international community, so let me talk to you about that. And it's very odd, speaking to you on a day where the world is talking about Haiti and that tragic earthquake that's taken place that's probably stolen many, many lives, and the horrifying situation we're seeing unfold in Afghanistan. Nobody, aside from us right now, is talking about what's happening in Ethiopia. Why? Why is the world not paying attention to Ethiopia?
Unfortunately, this is something that we observed in relation to a number of African countries where mass atrocities are happening today. Another example is Nigeria. And again, atrocities are happening on a regular basis. Killings are happening on a daily basis. Unfortunately, there is no enough attention on those countries. So we need to bring those important stories to the surface. And you've been reporting on those important topics on a regular basis. And of course, everyone working on the topic is very grateful. But unfortunately, not many reporters are engaged on those topics. So we need more attention. We need more journalists reporting on those important topics.